So there are a few vaccines that are really important to make sure that you don't miss. For example, children get a big round of vaccines at the age of 4. So those are really important. They're typically required before admission to kindergarten. Also at the age of 11, it's required that a child have a Tdap and a meningitis booster. These are really important vaccines. We think about tetanus a lot. We don't see it a lot, but that's because of vaccination. And pertussis, which is whooping cough, we have seen more of in the recent years. And that's something really important to protect not only your child, but the children around them that may not be able to be protected. The other one, meningitis, is also a really important one. Meningitis is an infection that happens around the brain and can be life-threatening. So we want to make sure you protect your children and others against that. Another meningitis vaccine is recommended to the age of 16 as well. So those are the big ones for back to school. Also, always worth considering getting a flu shot. This last year, we saw a pretty significant flu season, and it lasted all the way from October through May. We're still seeing some spotted cases through the summer of flu. It's always kind of around, so it's a good idea to vaccinate for that as well. Back to school anxiety is a really common issue that a lot of kids struggle with. There's a lot of ways that you can help prepare your child to be successful and have a lot less stress on that first day of school. One of the top things is the week before school starts, make sure you get your child over to the school, have them walk around the building and understand kind of what the process will be like on that first day. Make sure they know where their classroom is. A lot of teachers will do meet and greets beforehand, and those are really powerful ways to help prepare your child for that as well. Getting back into the routine after summer can be really challenging. Oftentimes bedtimes are later, wake-up times are later, and so kids are out of their normal day-to-day activity routine for school. So another good way to prepare your child is to make sure you start setting that alarm clock and getting them to bed at the time that you're expecting them to be to bed, when school's going to start, and then waking up at a time, having their clothes set, and things that help them feel prepared for success. Another good way to combat the social anxiety that can go with back to school for kids is having some play dates with some of their friends that they might not have seen as much over the summer. A lot of research has actually shown that having social camaraderie with the people that they know and are comfortable with helps them on those first days back to school as well. Sports physicals for student athletes are a really great opportunity to make sure that you're making that once-a-year visit to your primary care provider. It's always an option to see someone during sports physical season as well, whatever works for you, but getting your child in front of a healthcare provider to make sure that nothing has changed in your family health history, and other things that could be dangerous for your child that might have changed in the previous year are always a really good way to make sure that you're accessing healthcare as you should. Healthy snacks for children are really important, and I think sometimes as adults we don't recognize that children need to eat every few hours as well to make sure that they are able to focus and do all the things that they need to do in their school and after activity hours. So trying to focus on healthier choices as much as you can. I totally get being working parents, trying to balance getting those snacks in amongst all the other things that you're managing, but even grabbing some of the little prepackaged vegetables, little hummus packages, cheese and crackers can be great, an apple and either sun butter or almond butter or peanut butter packs can be really awesome, quick fuel for your children to help make sure they get through their days. Mental health struggles throughout childhood are really common, and the most important thing that you can do is recognize the signs early so that you can help support your child before things get severe. Some really common things that children can present with if they're having a lot of anxiety at school is outbursts at home, temper tantrums, those sorts of things that perhaps they weren't normally doing, isolating themselves from their peers and from their parents, having a lot of headaches, abdominal pain, really common ways. We see a lot of that in our clinic, and we never want to assume that it's due to anxiety, but oftentimes it is. And so looking for those really cardinal signs can help you get your child some support early before it becomes more of a chronic issue.